Thank you very much, all. Great to join you this afternoon for this lunchtime webinar. Thanks all for coming along. It's a pleasure to present to you my research looking at particularly the teenage pregnancy strategy and its effect on teenage pregnancy rates. And this was done as part of my PhD thesis, looking at the question of reducing teenage pregnancy rates overall. So what is so interesting about teenage pregnancy? Why is this a public health research question? Well, teenage pregnancy and public health are often seen as quite interlinked, and teenage pregnancy prevention presented as a public health priority. There may be higher rates of unplanned pregnancies amongst young women than older women. There may be a higher risk of health complications as well for women who become pregnant at a younger age, and it also may lead to entrenched inequalities as women who are born to teenage mothers themselves are more likely to go on and become teenage parents too. So preventing teenage pregnancy may be a route to tackling some of these health and well-being inequalities across society. The UK has seen historically quite high rates of teenage pregnancy, and this is a report published in 1999 that showed that a good number of other high-income European countries had seen rapid reductions in the 1970s, but the UK remained steadfastly high throughout that period. This prompted in 1999 the launch of England's teenage pregnancy strategy. The teenage pregnancy strategy had the aim of reducing teenage pregnancies by 50% in 10 years, and also to improve the outcomes amongst teenage parents. This was launched by Tony Blair's government in Westminster with the exclusive target of England's teenage pregnancy rates. Other devolved governments had the responsibility for Wales and Scotland. The teenage pregnancy strategy was looking at lowering England's rates across those 10 years. The strategy involved several components across those two aims. The first set of components for pregnancy prevention are the key ones we'll focus on in this presentation, including improved contraception access, improved education, media campaign, and linking up with parents of young people. A second arm of the strategy was support for teenagers who went on to become parents to remain in housing and education and employment. And all of this was stuck together, but held together by joined up local and national oversight and planning for all the strategy elements, and dedicated funding of over £280 million spread across the 10 years of the strategy's implementation. This is an expensive strategy. It was very well planned and coordinated and had the clear target of 50% reduction. Fast forward 10 years to almost more than 10 years ago, England appeared to have achieved this goal over the strategy period. So from the 1999 launch, including the midterm review in 2005 to the eventual end of the strategy in 2010, there did seem to be a clear reduction in teenage pregnancies across that period. When measured in comparison with the later rate in 2014, the strategy does appear to have achieved its goal of a 50% reduction from a high of 46, almost 47 pregnancies per 1,000 women aged under 18 to a low of just under 23. This is a drop of 51%, and it reached the strategy goals. This has led to the strategy itself being praised as a repeatable and successful intervention, either for repeating in the UK for further reducing pregnancy rates or for transferring to other countries with high rates. Now, this big query over this is what would have happened in the absence of the strategy, and particularly when you look at Scotland and Wales, which didn't have the same strategy spending and didn't implement the same strategy's approach. They also saw large drops in pregnancy rates across the 10 years of the period. So the question of this poses is, in England, was the reduction the strategy that caused it, or did other things contribute? And therefore, did the strategy take the most effective approach? Did it miss opportunities for greater effect by doing other things, if it seems to have not contributed much at all to England? To evaluate the strategy, we'll look at then what comparators we could use to show what would have happened in unexposed England. The natural thing that people have in mind for evaluating an intervention or a drug, for example, would be a randomized controlled trial, comparing exposed England to an unexposed version of England. We don't have an unexposed version of England to test, but we can use natural experiments to find ways of comparing England with other countries and accounting for some of the differences in order to see what a no strategy England would have done. The outcomes I look at in this are birth and pregnancy rates to teenagers, which are obtained from sets of administrative data. The first approach I used was the interrupted time series approach. This is just a general background overview, and I looked at Scotland and Wales rates as controls compared to England as an exposed country. And all this data is taken from the England-Wales data from the Office for National Statistics and Scotland data from ISD Scotland. And the big question in this, looking at that interrupted time series model, is these two coefficients at the end. Was the strategy able to produce a difference in the trend and level change in England compared to Scotland and Wales? To draw that out in graphs, give it a bit more clarity. First of all, looking at England only, the interrupted time series method looks at the pregnancy rates before and after and fits straight lines into each one to try and detect whether there was a change in trend associated with strategy exposure. And the strategy launches in the dotted line in the middle there. It appears that before the strategy, pregnancy rates were going up, and if they continue on that way, maybe they would keep going up that dashed yellow line. But after the strategy, the rates are hugely decreased. So we can take this change in trend here as a measure of the potential effects of what the strategy was able to cause. And that's quite a substantial result. That's 2.22 fewer pregnancies per year across the strategy period, which would be enough to reach the target. This is, if you look slightly before the strategy launch, it doesn't appear to be that well fit. There seems to be a bit of a bump coming up. That may be the hypothesized effect of the pill scare in 1996 that caused people to stop, or fewer uses of combined oral contraceptive pills, and hypothesized increase in pregnancies. If we allow for a correction for that, it does seem to have a better fitting model before the strategy period, a slightly lower gradient projected for no strategy England after 1999, but still a significant strategy effect causing that change in trend of 1.41 pregnancies fewer per year. But those are the uncontrolled models. Our next big question is what would have happened if the strategy hadn't launched at all? And to do that, we bring in the Scotland and Wales data. England compared with Scotland, first of all, is if we measure the trend change Scotland saw in 1999 and apply it to England, what would have happened? What difference do we see there? And now we see that projected line in a no strategy England, it's very hard to make out because it's almost identical to the observed actual strategy effects line. And there seems to be very little difference in trend change associated with the strategy exposure, almost slightly less than 0.1 pregnancies per 1,000 women per year. So comparing with Scotland, it appears that England saw exactly the same effects as an unexposed no strategy Scotland. Similarly with Wales, even though Wales had higher rates, they saw again the same change in trend roughly as England, again indicating that a no strategy England would have seen that same trend change as the no strategy Wales. So there appears across both of these comparisons to be little effects attributable to the strategy itself. This was consistent across all the comparative models. I used different age ranges, under 16 and under 20, longer time periods, and added other correctors, and same consistent results of no strategy effects. Scotland and Wales saw very similar changes in the absence of the strategy. There's still questions we can ask about this. Was this a common cause independent of the strategy that would have happened anyway, or is there some contamination in England and Wales? To answer these questions, then we move to the synthetic control method. It's a different method I used to compare England to a wider set of countries, so not just within the UK, but comparing countries that could not at all be affected by the strategy and we're not taking simultaneous similar actions. So this uses wider sets of data and the synthetic control methods. To give this might take a little bit of explanation because I love the synthetic control method, but it's not super familiar. These are the pre-strategy rates across all the potential comparator countries. And we see not all of them are anything like England. Some of those countries have very, very low rates. So the question is, how comparable are they to England, which had fairly high rates? Well, the synthetic control method creates a weighted average of these countries that best approximates pre-intervention England to show us how closely it can predict a post-intervention England. So the method chose these 3 countries to weight, to put together to make a pre-intervention England. And to show you how that works, it takes the pre-intervention rates of these, assigns these weights to them, and when multiplying it together as an average, this is the no strategy prediction of pre-intervention England. And you can see that's very closely fit. That suggests that this predictor is going to be very good at predicting post-strategy England as well. We then take the same weights, apply them to the post-strategy period for these 3 countries. And actually what we see here is that it predicts, in the absence of the strategy, that England's rates would have done almost exactly the same thing, would have reduced by this amount, potentially due to a cause that's common to all of those comparator countries. To summarize then, there are several possible causes of falling teenage pregnancy rates, and some of these were implemented in the strategy, but both of the evaluation methods I used gave results consistent with no effect of the strategy. This was consistent across all sensitivity analyses. The strategy may have missed opportunities for greater impact on teenage pregnancy rates. To compare with previous research, this does contradict the previous findings of 51% reduction, but my analysis is using more robust methods across administrative data to give more suitable comparators. So even though the strategy is cited as a model for rate reduction, there's still some suggestions that the strategy was not the primary effector. To briefly kind of outline some of the implications of this, I would suggest that robust intervention design and evaluation of interventions is a key thing. This is the recent guidance produced by the MRC on development and evaluation of complex interventions. And these guidelines, good development and evaluation is not always done. And there's several examples in recent history of policies that have not had a good result, but may not have been designed well. The teenage pregnancy strategy appears to have contributed little to the falling rates in England, so future teenage pregnancy prevention policies should seek to understand the true causes and not rely on reproduction of the strategy's effects. Thank you very much for listening. I have a few acknowledgements of those who have helped and contributed through this research, and a big list of references on another slide, which you can ask me about later on. But thank you very much for listening, and I hope that that's been a fruitful and helpful overview of my research. I'm happy to take questions.